So I think, in ASCO 2022, there are a couple of abstracts that I would was very interesting. One is a trial called a Paradigm study, which is a randomized phase 3 study looking at FOLFOX plus Panitumumab versus FOLFOX plus Bevacizumab in first-line setting. Now, in the past, there's always controversy about what to do with a left-sided KRAS wild-type tumor, because based on the retrospective analysis of prospective study with FIRE3 and CALGB 8045 study, it's sort of the patients who benefit from anti-EGFR are patients who are RAS wild-type, who happens to be left-sided tumor. There was no really improvement in PFS, but there was an improvement in overall survival in those settings. So based on that, sort of practice, at least in Europe, was that they adapted using EGFR inhibitor in first line. On the other hand, US, we're still using Bev in first line. So this is one of the other large phase 3 study, prospective study done, showing that, once again, very consistent with other two studies, that patient with RAS, that patient benefit from Panitumumab, anti-EGFR with chemo, are patients who are RAS wild type, who are left-sided tumor, showing overall survival response. Interesting enough, compared to the other studies, if you do that combination in a right-sided tumor, it seems like EGFR may have a detrimental effect. So once again, based on that, I think it confirms our finding that if you want to select patients who will benefit from this combination, are patients who are RAS wild type, who are left-sided tumor, who probably do not have any HER2 amplification as well. The issue, I think the main issue that in US why we don't do that regimen typically is because of the toxicity. We do value quality of life very much, and the rash becomes an issue with EGFR inhibitor. Therefore, I think that's one of the reasons why, at least in US, we still, despite this positive phase 3 study, which we sort of knew the data before, I'm not sure if this is going to change our practice, whether in terms of using EGFR inhibitor in first-line setting.